Okay, guys. So for your oral hygiene, you'll start with your oral hygiene with your conscious patient, followed by unconscious patient, and the third will be the care of the dentures. For your oral hygiene with conscious patient, basically the patient is mobile, the patient is cooperating, the patient is responding. So you just need to assist the patient or do the toothbrushing. Okay, you need to clean the mouth and the teeth, basically with the patient. So you do your usual introduction or your opening spills or opening steps. You start with checking the record, checking the chart for you to be able to know what type of care or type of care that you will be doing as per the advice of the doctor. If the doctor is putting on the chart that you need to do this hygiene procedure, so at least you will know because you have the access or you have first check the chart, okay? Then second is you need to do your hand washing because you wanted to prevent cross contamination, and then go to the supply room and get all the supplies needed or the specific procedure that you will be doing. For the hygiene procedure, you just need to collect or just check which one is which equipments are being used. So for example, you have already identified the different equipments. Just bring along with you the equipments on the bedside of the patient's bed or room, so that you'll be able to prevent or you can save your time and your energy of going back and forth from the supply room to the patient's room. Okay, so I already have like prepared and put it on the side. Then for your oral hygiene, what are equipments needed? You just need to have your toothbrush, your toothpaste,
Kidney
your
basin.
glass, okay, your kidney basin, okay. You need to have your towel, okay. Basically, you need to have your water, right? So you just assume that with this cup, you have all your water for your gargle, okay? So first is after gathering equipment, you need to close the curtain to promote privacy, and then after that, you need to it's either you can put the side rails up on the other side, which is far from you, and you just need to put your side rails down on the side which is nearest to you, okay? So that you can have an access or easy access on reaching the patient's body parts, okay? Because the side rails is down. So and then after that, you just need to the patient's bed, you need to adjust on a working comfortable position. Okay? Basically, if this is the comfortable working position, then let it be. If the patient wanted to have like higher, then you can just adjust the bed. Ideally, the beds are automatic. Okay? So you just need to press and then it will be elevated. Okay? So you check the patient's identity, like asking the patients, may you know your good name, ma'am? And the patients will respond, and then check for to verify, check the wristband or the name tags, so to identify that you are doing it to the correct patient. Okay, and then you need to explain the procedure, madam. I will be doing your oral care. I'll just help you do your toothbrushing. Is that fine with you? The patient said yes. Then you can just proceed with the procedure. Okay, so you're done with the opening. You start with your procedure. Okay, for your oral care, you just need to place the towel across the patient's chest. Okay, and then basically I need to get another pillow so that it will be elevated. Assume that we have already elevated the bed, but because the bed is not working, you just need to use these pillows for us to allow the patients to elevate the head part. Okay, so basically if you have adjusted the bed and the patient is ready, then you need to have your, what do you call this one?
Kidney basin.
You need to put the kidney basin. Yeah, it's working, but you need to have a force. Yeah, you just need to put your kidney basin just behind the chin of the patient. Okay, basically before that, make sure you have your gloves. Okay. Okay, and then just need to get your toothbrush and the toothpaste. If the patient has its own toothpaste, then you can just use it. But if not, you can just use whatever the available supply you have. Okay, you put a small amount of it, or ample amount of it of the toothbrush. Then you can ask the patient to open your mouth for you. Okay, so you start with the toothbrushing. You start with your upper teeth. For the upper teeth, you just need to start with the upper side, okay, inner, and then go to the other side, upper side, and then front, upper teeth, okay, and then you can go to the lower teeth. You can go to the sideward, side, inner, and then front. And then some toothpaste, they have this rubber on the other part of the bristle. You can just use that for your tongue. You can ask the patient, "Ma'am, can you have your tongue out, okay, for me?" Then, okay, the patient will, and then you'll just have to clean the tongue, okay? And after that, you can grab the
Water.
okay, the cup with the water and ask her to rinse, okay, or gargle. Then you can ask her to spit on the kidney basin. So, okay, after that, then if you think that there's still toothpaste on the mouth, again you can offer another water, okay, or the glass, okay. So assume that you have already cleaned everything, gargle. You just remove it, remove the kidney basin, okay, and then you can just have to let it dry, okay, the excess fluid or liquid on the mouth, okay, or outside the mouth, okay, let it dry, and then you're good to go. You just need to, okay, position the patient in a comfortable position before you leave. Give the call light for emergency if there is assistance that she is asking or will be needed in the future, and then you open the curtain. After opening the curtain, you just need to say goodbye to your patient. Now, thank you so much for today. I will just come back, whatever. I just press the call light, whatever you need assistance. Okay. Then you gather back the equipment, go back to the supply room, and then you need to remove your PPE or such as your mask, your gloves, and then you just do your hand washing, and then you document. Okay, that's for your patients with oral care with conscious patient. Let's proceed to your unconscious patient. Same thing for unconscious patient. Okay, the patient is not responding, so you will do the total oral care. Meaning to say, you cannot ask the patient to gargle, you can ask the patient to spit out because she is not responding or he is not responding. So what you will do is, from your end, make sure that you are doing all the care, all the oral care. Okay? So for this one, you just need to do your introduction again, the opening, but you cannot ask the patient because she cannot respond. But the only thing that you need to verify the identity is to check the wristband. Okay? And then after that, you need to first is assume you have your gloves. Okay? Everything is put it back. There's no liquid or something. So on this unconscious patient, first is you just need to tilt the head of the patient to the side, because while you are tilting the head, the reason is you are trying to prevent aspiration or the fluid will go to the lungs. Okay, that's why you are tilting. You are just putting the head on the side, so that's whatever the liquid, whatever the fluid will just go down and will just drain outside the mouth. Okay, because if you will have to like this, the patient may that will cause further complications. Okay, or aspiration. So I'm tilting the head of the patients on the side, and then I need to get the towel. Okay, and I need to put it on the side. Okay, so basically I already did the positioning of the patients. Okay, and I'll put the towel on the side to drain whatever the secretions or fluid that comes from the mouth, and then I'll put the kidney basin again on the side, because wherever is the mouth, and you just need to put it tight and put his head. Okay. So the patient, you can't do instructions. You cannot give instructions to the patient because the patient has a time basically. So what you'll do, you just need to use some So for this one, you just need to use this padded tongue depressor, okay, to open, okay, padded tongue depressor, okay. This is used to open the mouth because the patient cannot open consciously the mouth, okay. So you need to have the padded tongue depressor to open the mouth. You need to have your toothbrush and your toothpaste. So put an amount of toothpaste on the toothbrush. And then you just need to use this padded tongue depressor to retract the mouth or to open the mouth, like, okay? Yes. And then open the mouth and then do the toothbrush. Same direction. Start from the upper teeth, sideward, another sideward, front, and then on the lower teeth, use this one. So at least you have a steady, and then up and down. Okay, and then front, and then the patient cannot gargle, cannot spit out, right? So in this case, you need to use the suction apparatus. In the suction apparatus, you need to ask supervision from the nurse because you are not allowed, it's not part of your duty. Okay? So the nurse will do and will operate the suction for you. With the suctioning, there is two suction catheter. One will be for the draining or the sprinkling of the water, and then the one is for the suction. Okay? So you will have the the button that you will press, then you have to rinse. This is with the water. So you put it inside with the water to rinse, and then after that, just need to press another button to suction the water. Okay, so after the suctioning, so you are not sure that they might or there might be any excess water or not, it's not drained yet. So what you will do, you need to use your padded. You need to have your foam swab. Okay, for foam swab, this will remove the excess water inside the mouth. Okay, foam swab. So again, use this padded tongue depressor to open the mouth, and then you have to, because this is a foam, so it will have to drain whatever or like absorb the excess water. Okay, I get it, and then after that, remove. So you are now sure that there's no water, excess water, because it was suction and it was like removed with the use of foam swab. Okay, so remove the kidney basin, then you pan dry. Okay, there might be excess water outside the mouth because of the suction that you have done. Okay, then you pat it dry, and then you return back the head of the patient on the original position, and then you can just adjust the bed. Okay, put the side rails up. Okay, and then you cannot give the call light because the patient can't press the call light, right? So anyways, they will have like another maybe monitoring or something. So you just need to open the side rails, and then patient's comfortable position, gather back the equipment, okay? To the supply room, remove the gloves, and then do hand washing, you document. You're done with the conscious patient. Okay? The third one will be your denture care or the false teeth. Okay? So basically, some of your patient might have or might using any, especially for, yeah.
Unconscious ka.
Will be the next patient, the whole patient of this.
You're unconscious, why?
Okay, so basically, denture care. For denture care, so most of your patients, especially for elderly, they're using false teeth. Okay, and it's your responsibility as a caregiver or as a nurse assistant to care for them, to clean them. Okay, but basically, you just need to do your introduction, your opening statement, and you identify the patient, asking the name, is there the procedure, madam? I'm here to help you clean your denture. Okay, is that fine with you? The patient said yes, then you're about to start. Okay, how to start? Basically, you have the gloves. Okay, I'm not removing, but ideally you need to change. Okay, so first is I will need to inform the patient, madam, I want to remove your denture from your mouth, okay? So start with removing the upper teeth, okay? The upper teeth, in the upper teeth, you just need to ask, Madam, can you open your mouth for me, please? So if you can have like, first is gently shake it, and then gently remove it, okay? So like, don't like, okay? Might see blood after, right? And then after that, then you can put it on the denture cup, okay? So denture cup, you can put it like this, and then you remove another one, okay, from the lower teeth. Like gently shake it, and then remove it, okay? Then put it on the denture cup. Then ask the patient, Madam, I'll leave you for a while because I need to go and then clean your denture, okay? So on the video, you will see that there is that the
zinc.
nurse or the nursing assistant brought this denture, the patient's denture, to the sink, okay, wherein there's a faucet. So just imagine that there is a faucet. I have a faucet at the side, and then I'm putting a towel, okay, just a towel on the side of the sink, just to protect the denture from falling or from breakage, right? Because tendencies, if there is no like towel, that might like, okay, and then most of the dentures are expensive, right? To protect it. So put in here, and then first I need to take it out from the denture cup. I need to clean the faucet, clean the food debris. It says food debris or food particles. Clean it, and then another one, the lower teeth. Okay, and then get your toothbrush with the toothpaste. Then do your usual toothbrushing as if that you're toothbrushing yourself, right? So you have your toothpaste. If the patient has their own solution or has own toothpaste that you're using for the denture, you can ask for that for you to use it. If not, then just use whatever supply is available, okay? Then you need to have your toothbrushing cleaning. Again, same side, front, okay? And then side, front, and then you just have to rinse it. Okay? After rinsing it, then also this denture cup, you need to clean it, and then you need to get a solution for soaking, okay? So for soaking the denture, there should be a solution. Some patient has their own solution, okay? So, and then if not, then you can just ask again whatever the supply is available, right? So I put the solution, for example, and then I am now putting on the cup to soak. And then I'll put the cover and I put the name on it, okay, or label it, so that to avoid mix matching or whatever, it will be lost or whatever problem will arise. So I'm putting a label, and then I will make sure that you left the sink clean, and then after cleaning it, and then you can just go to your patient, Madam, I'm done cleaning your denture. Is that fine that I will be putting, or would you like me to put back to your denture, or would you do it by yourself later? If the patient said, "Oh, I will just do it by myself later because I'm just wanted to feel relaxed and maybe sleep," okay? If the patient said, "I will just do it later," make sure that you are putting the denture cup with the denture on the side that he can easily grab it. Okay, for example, in the bedside table, you can just put it on the side. So the moment that you wanted to put it back, at least you can easily grab it. Okay, and you are putting it there, and then you can just tell your patient, "Madam, open the curtain." Okay, after open the curtain, give the call light, the usual closing, and then you just need to gather the equipment, say goodbye to your patient, remove the gloves, hand washing, and then do your documentation. You're done with your oral care. Okay? Yes.
Even a patient wants you to fix it for them.
Huh?
The patient wants you to fix it for them.
That's why you can put it back. That's it. Right? Just the same.
Okay, just practical on how to put it.
Yeah, just the same. put it back inside. I think that you can, time to time, madam, is it painful? You can just like, put it. Okay, sometimes if the patient are conscious, they will just do it by themselves while you are looking at them. Okay? It's a case-to-case basis. As long as they feel comfortable, you can put it like the same as you're putting yours as well. Okay? No restrictions as if that. Sometimes you can just like put it like this. But some patients, especially for elderly, they wanted to put it by themselves. Okay? Because they're so sensitive. Okay? There's no issue of putting it as long as they're comfortable. Okay? Always check their comfortability. Okay? If they're not comfortable, then do not push. Let them do it. Okay? Then you're done with the oral care. Let's proceed to your bedtime. Okay? Okay?